definitely buckle up for that. Meanwhile, the National Police Service and Kenya Prison Service medical scheme has transitioned to the Social Health Authority framework in a move officials described as a game changer. Interior and National Administration Cabinet Secretary, that is Kipchumba Murkomen, and his health counterpart, Eden Duale, presided over the event in Nairobi and said the transition marks a major step in addressing the welfare needs of officers. And as Samira Mohammed reports, authorities say the transition to the SHA framework is part of a broader security sector reforms aimed at improving the welfare of officers and their dependents, and its implementation has been carefully structured to ensure continuity of care, including for those currently admitted in hospitals.
It is a transition that has been described to represent notable progress in Kenya's security sector reforms, reinforcing the government's commitment to improving healthcare access and support for the officers who serve the nation.
We have gathered here to officially welcome the brave men and women of the National Police Service and the Kenya Prison Service into the Social Health Authority family through the launch of Usalama Cover.
The National Police Service and Kenya Prison Service medical scheme has undergone a significant transformation, shifting to Social Health Authority framework.
Today we are here for one specific reason: to formally onboard the National Police Service and the Kenya Prison Service onto the Public Officer Medical Scheme Fund. But this moment is bigger than health scheme. It is evidence of a government that is systematically changing how it treats its security officers.
In a transition described by officials as a game changer, marking a pivotal milestone in enhancing the welfare of officers and their families.
The packages available in this medical cover are much more enhanced, and by our transitioning to the Social Health Authority family, we are entering a workable government-to-government arrangement with enhanced and more practical arrangement underpinned by efficiency, effectiveness, and dignified service.
It's important for all Kenyans to know that you can go to any hospital in Kenya and be treated freely for 24 hours by SHA to make sure that you are stabilized and protected. And our officers are going to be benefit from this immensely, considering the kind of work they are going to do. Besides their enhanced cover, also in cases of emergencies, them and their families are going to be able to benefit from this.
The new scheme is part of a broader government efforts to improve the welfare of officers in the country's security services, a sector that has recently received increased attention from the administration.
This moment is bigger than health scheme. It is evidence of a government that is systematically changing how it treats its security officers under the bottom-up economic transformation agenda.
According to officials, the change will greatly improve healthcare access for officers who previously depended on a smaller network of hospitals, thus improving their access to quality healthcare from the previous 800 hospitals to 6,000 public, private and faith-based facilities across the country.
Under the previous arrangement, our National Police Service and Prison Service officers would access care from only 800 facilities. That number now rises to over 6,000 public, private, and faith-based facilities across the country.
Under the SHA framework, officers and their families will benefit from an expanded package covering outpatient and inpatient services, dental and optical care, emergency services, specialized treatment, annual medical checkups, provision for overseas treatment without exclusion, access to emergency and critical care, and an expanded list to eligible dependents.
The new scheme provides a more comprehensive and sustainable medical cover, including last expense benefit for officers and their dependents. Under the SHA framework, officers and their families will benefit from an expanded and comprehensive package covering outpatient and inpatient services, dental and optical care, emergency services, specialized treatment, and annual medical checkups.
As this framework takes effect, it is expected to significantly uplift the quality of life and welfare of security officers, marking a new era in institutional healthcare provision within Kenya's security services. Samira Mohammed for TV 47, Nairobi.